Hi again. If you're just joining us, feel free to introduce yourself in the chat box and we'll go ahead and get started. My name is Tara Koch. I am the project coordinator for the Southeast Mental Health Technology Transfer Center School Mental Health Initiative. We are very excited for today's learning session about financing school mental health through Medicaid. We encourage you to introduce yourself in the chat box and turn on your cameras so we can see each other's faces. And if you have any questions during this webinar, please put them in the chat box. We'll have some time after the presentation for a Q&A. And we encourage you to use the chat box to share resources with us and other participants as well. And we'll be sending some links in the chat, including the slides for today's presentation. So keep an eye out for those. And I'm going to read a quick disclaimer that's required by our funders. So the Southeast Mental Health Technology Transfer Center, or MHTTC for short, administrative supplement is funded by Substance Abuse and Mental Health Services Administration, SAMHSA. The opinions expressed herein are the views of the presenters and do not reflect the official position of the Department of Health and Human Services of SAMHSA. No official support or endorsement of DHHS, SAMHSA, for the opinions described in this document is intended or should be inferred. And a quick introduction to the Southeast Mental Health Technology Transfer Center. Today's session is brought to you by the Southeast Mental Health Technology Transfer Center, or MHTTC for short, as I mentioned, and specifically the School Mental Health Initiative. We are located in Atlanta, Georgia, at the Emory University Rollins School of Public Health. We're proud to serve the 8 states in HHS Region 4 that you see pictured here. Our center includes faculty and staff with expertise in public health programs, finance, policy, and health systems. And this provides us with a unique lens through which we address mental health priorities in our region. The goal of our center is to accelerate the adoption of evidence-based mental health programs and practices by providing training and technical assistance to Region 4. I just want to put it in everyone's head that at the conclusion of this webinar, you will see a link to an evaluation in the chat box. And we ask that you take a few minutes to provide us with your thoughts. This is really important for us. It is required by our funders. And at the end of the surveys, you will get a certificate of participation. And I would like to introduce our presenter, Dr. Adam Wilk. Dr. Adam Wilk is a health economist and a health policy researcher at Emory University's Rollins School of Public Health in the Health Policy and Management Department. He has 15 years of experience in Medicaid consulting, technical assistance, and research. Dr. Wilk's research focuses on access to care for low-income and underserved populations, particularly those with chronic illnesses and state financing and policy related to providers' operations and care. And without further ado, I'll hand it over to you, Dr. Wilk.
Thanks very much, Tara. Appreciate the introduction, and thank you all for joining us. I appreciate seeing you all here, including some faces and names that I recognize from previous webinars and events. Good to see you all. All right, so here's the agenda for today's webinar discussion. I'm going to start by listing our learning objectives, what we hope you all take away from today's discussion. I'm going to provide a few slides of background on Medicaid as a program in general before going into the meat of today's discussion, which is if you're looking to seek Medicaid reimbursement for a given service, specifically a school mental health service, what are the requirements you need to meet? There's 4 of them. I'm going to walk through all of them in detail. Then after I conclude that discussion, there'll be some time at the end for Q&A with myself and my colleague, Wilk Hu, who will be joining me here in a moment. I'll start with the learning objectives, what I hope you all will be able to do at the end of this discussion today. I hope you'll be able to identify those 4 requirements for receiving Medicaid reimbursement for school mental health services. That's the big overarching objective for today. And then our 2 sub-objectives, 2 and 3, I hope you'll be able to identify the Medicaid benefits that can cover school mental health services, and specifically the services covered by the early and periodic screening, diagnostic, and treatment benefit, usually abbreviated EPSDT. So as promised, a couple of slides here of background on Medicaid. What is it? Well, it is not a state program. It's not a federal program. It's a jointly funded program drawing on federal and state dollars, but it is primarily administered by states within some federal guidelines. Now, within those guidelines, each state has flexibility to design its Medicaid program to its liking. And for that reason, no two states' Medicaid programs look alike. So if you're thinking you might want to learn best practices about Medicaid billing from a colleague in another state, you'll have to remember that their Medicaid program is not your Medicaid program, and there may be some important differences. I often say, if you know one Medicaid program, you know one Medicaid program. Now, Medicaid is an insurance program primarily, so that its purpose is to provide health insurance coverage and improve access to healthcare services for its beneficiaries. The main covered populations, the main folks who are its beneficiaries, include women, pregnant women specifically, children, primarily of interest for our discussion today, individuals with a disability, as well as low-income individuals of other groups. And it is a very big program. Across all of the states in the US, it covers about 48% of children, including 83% of low-income children. That's 39 million children and counting as of the middle of last year. It's a very big program. And as such, it is a very important source of financing for school mental health services as well. Between its large number of beneficiaries among the target child population and the fact that Medicaid also is the largest single payer of mental health services in the US. In truth, it accounts for 46% of all mental health services for school-age children nationwide. And it does cover a wide range of mental health services. It covers many different types of therapy and screenings, diagnoses, pharmaceuticals in many cases. So a lot of different services can be covered in Medicaid. Importantly, the main takeaway for Medicaid is that it does facilitate access to healthcare, particularly for low-income children and families, for those of us who are focused on school mental health services. And there's a lot of good evidence, too, that Medicaid does effectively facilitate access to healthcare. Medicaid beneficiaries relative to uninsured similar folks, Medicaid beneficiaries have better access to healthcare, they use more services, they even have higher self-reported health and lesser financial insecurity due to medical bills or the like. So the evidence supporting Medicaid is quite strong. All right, so now we're going to introduce some audience participation part of our discussion. We've got a few poll questions throughout the talk, and we're going to start with this first one, if we can trigger that right now. Which of the following statements most closely reflects the biggest question you currently have about Medicaid and financing school mental health services? Just giving us a sense as to where your biggest questions are at this point. Give you all some time here to answer this poll question. All right, let's get the tabulations and totals here. All right, so we've got a wide distribution of responses here. The plurality of respondents indicated you're not sure if services provided on school grounds can be reimbursed by Medicaid in your state. We have a few slides to talk about that towards the end of our talk, and I'll point you to some resources about that as well. But healthy chunks of our participants today also indicated they don't know what services Medicaid can cover. I'm going to be talking about that in just a moment here. And also, some folks indicated, I'm not sure if the providers in our school district can bill Medicaid. All right, well, that's going to be the third requirement that I'll talk about today. Hopefully, I'll be able to address everyone's questions among these top four, but there's a few folks who indicated other as well. So everyone, please do feel free to make continuing use of the chat to present questions, some of which we'll be able to answer as we go, and some of which we'll be able to answer live towards the end. All right. So let's dig into these four requirements for seeking reimbursement for school mental health services. There's one for each of these four key terms on the slide here. One requirement related to the service being delivered, one related to the recipient who actually receives the service, one related to the provider, and one related to the setting. Start with the service. The service, in order for the service you're talking about to be reimbursable by Medicaid, it has to be a Medicaid covered service. That is, it has to be on the list of services that Medicaid covers in your state. With respect to the recipient, the student or client who actually receives the service must be enrolled in Medicaid in order for the service to be billable to Medicaid. The provider who provides the service must be a Medicaid certified provider. And I'll explain what that means in a little bit. And in your state, the Medicaid program has to have specified that the school is an acceptable setting in which those services can be delivered. Many of those services can be delivered in community-based settings, but if they're billed in a school setting, if they are rendered in a school setting, there may be different rules about whether the service can be billed to Medicaid. We'll cover each of these. But we'll start with coverage. Medicaid can pay for a wide range of services, which we will broadly classify as direct services and administrative services. Yes, in fact, Medicaid can help pay for some administrative services associated with the delivery of other direct services or other things related to Medicaid. I'll get more to that in a minute, but let me start with the direct services, which is what we conventionally think of as what Medicaid or other insurance would pay for. There's a large bucket of services that Medicaid will pay for, and those are generally broken down in the Medicaid program into mandatory services and optional services. Mandatory services are services that the federal government requires that every Medicaid program has to cover. It's a fairly sizable list and includes a fairly generous benefit, the EPSDT benefit, which I will talk again about in the slide here. And then there are optional services. Many states cover more services than just the mandatory ones, just the ones federal government requires. And yet, there are also many states that choose not to cover many of those services on the optional services list. Telehealth is a good example of that, where it's covered in some states and not others. I'll talk through that example in a moment here too. And I do promise I will talk about administrative services after that. We're going to start with the mandatory services. So again, this is a list of services that the federal government mandates every state Medicaid program has to cover. And it's a wide list of services, but one I wanted to draw your attention to is this early and periodic screening, diagnostic, and treatment benefit, the EPSDT benefit. This is a mandatory benefit for all Medicaid enrollees under age 21. So the student age, the school age population we think about most in this context is included. And it covers a wide range of screenings and diagnostic services and associated treatments. For more background on the basics of EPSDT, I would direct you to the resource linked at the bottom of this slide. So this is a good opportunity for me to remind you all that I would encourage you to download the slides from the Southeast MHTTC website. I believe you may have seen a link for those in the chat, or we may add another one now. But click on the link here, and there will be many links like this in little orange boxes at the bottom of the slides for other resources relevant to today's discussion. So getting back to EPSDT, it's a very generous benefit. With respect to mental health and substance use issues, EPSDT covers a wide range of screening services first. That's where we'll start. The set of screening services related to mental health and substance use includes autism screening, depression screening, assessments for tobacco, alcohol, and drug use, and others related to school mental health. And then here's sort of the kicker with EPSDT. Whatever individuals are identified as potentially at risk for, say, depression or autism or these other concerns using an EPSDT covered screening, Medicaid must then also cover the costs associated with any diagnostic services and needed treatments for those conditions. Yeah. So if an individual is identified through the depression screening tool, the EPSDT covered screen, as in need of a diagnostic service, Medicaid will cover that. And then if they are diagnosed with a condition and have a demonstrated medical need, Medicaid will cover associated treatments. Even if those treated services are not otherwise on the list of services that Medicaid says it will cover for its beneficiaries, so long as the individual's condition was identified through these EPSDT covered screenings and diagnostic services, the treatments will be covered through the EPSDT benefit. It's a really generous benefit, and because it's sort of complicated in this way, that it does have to come through an EPSDT covered screening first and then a diagnostic service before those treatments will be covered, I think that's one of the reasons why this benefit is relatively underutilized and potentially really important in the school mental health context. But it's certainly not the only mandatory benefit that Medicaid must cover in your state. There are other school mental health related and outpatient mental health related services on this list too, including a number of physician services and other practitioner services, as well as the services of providers based at rural health clinics and federally qualified health centers, many of which I'm sure many of your schools and LEAs are partnering with now. Or could partner with. Here's another resource related to this discussion of mandatory and optional benefits, including this full list of mandatory services. It's available here at the MACPAC website that I've linked at the bottom of the slide here. I forget off the top of my head what MACPAC stands for, but it's a payment and advisory commission that provides national guidance and resources related to Medicaid nationally, and it's worth knowing about. All right, so when we're moving past mandatory services, there are also these optional services that some states choose to cover in their Medicaid programs. One example is telehealth or telemedicine. So during the COVID-19 pandemic, of course, telehealth and telemedicine services have really been an important source or mechanism by which people access services. And many states have expanded Medicaid coverage of telehealth in various ways during the course of the COVID-19 pandemic. But I should say, I must immediately point out, many states have made the terms of this coverage temporary. So in many states, the coverage of telehealth and telemedicine services and Medicaid programs may have expired in the last year as the coverage terms of this policy were tied to the public health emergency. So when the public health emergency was declared at its end, the telehealth telemedicine services may have no longer become covered. So if you and your school mental health programs are interested in leveraging Medicaid financing for telehealth or telemedicine services, I would strongly encourage you to check in with your state Medicaid office and verify the current status of those policies to verify whether or not telehealth and telemedicine services might be covered in your Medicaid program. There are also other optional services that may be important for you to recognize as opportunities to leverage Medicaid financing, including things like case management, home and community-based services, and prescription drugs. Yes, all of these are optional benefits. Many people think it's absolutely the case that Medicaid always covers prescription drugs, but it turns out it's not the case. There are some states that do not cover prescription drugs at all. And so it is important to get to know the full list of benefits that are covered in your Medicaid program, including these optional services. And so you should definitely check out your state Medicaid program's website. There's also more information on CMS's website about mandatory and optional Medicaid benefits. I did promise I would come back to administrative services. So here we are. Medicaid will in fact cover expenses associated with certain types of administrative services. There are two main types. One is administrative supports for direct services. So again, we think about direct services as mainly what insurance programs like Medicaid will cover. But if you or a staff member in your LEA or school district is busy scheduling or arranging transportation to Medicaid covered services that it would be rendered to a student or client in your district off-site, then Medicaid will actually compensate you for that staff time associated with the scheduling and arranging transportation. There's also outreach and enrollment services that Medicaid will help cover through this mechanism. Tasks like referring a family to the local social services office to apply for Medicaid benefits, those tasks and associated time can also be billed to Medicaid. Now, the processes by which Medicaid will pay for or receive bills or claims or other information about these administrative services may be different from what they typically have as their process for more direct services. So I would encourage you to check out some of our additional resources on our Southeast MHTTC website related to Medicaid billing for administrative expenses and the different processes related to cost-based reimbursement and fee-for-service reimbursement that may be involved there. All right, so I hope you're keeping the questions coming in the chat. It is also time to re-engage you with another poll question here. So let's pull that one up. Which of the following mental health services do you or would you like to bill Medicaid for the most? So we're including here some of the different mandatory and optional and administrative expenses that I've been talking about on the preceding slides. Which of these are most important for you to bill Medicaid? All right, let's give you a little bit of time here to answer the question. All right, Sarah, when the responses start to slow, let's pull up the results here. Great, okay. So a preponderance of people who responded to this poll indicated that treatment for mental health problems, such as counseling, is what you would consider most important to bill Medicaid for. And that's a good thing. Medicaid has very well-trod pathways and procedures for billing for those kinds of services. And so if you are not familiar with the process for billing Medicaid for those kinds of services when administered on school grounds, there is likely lots of resources in your community to help you with that, including through the billing departments at local community provider organizations. So if you happen to partner with one of those or you know someone who does in your area, you can get lots of good information about how to bill for that. I'm also seeing at least a good handful of folks indicating that they're interested in billing for screening services and for administrative expenses. That's great. I hope you make great use of the EPSDT benefit for the students in your districts. And I hope you take a few moments to look at some of the resources on our website about EPSDT, as well as the processes for billing Medicaid for administrative expenses. All right. So the second requirement, let me take a step back. Just to remind you all, the first requirement of the 4 was that the service in question has to be a Medicaid covered service. Now we're moving on to the second requirement, which is that the student or client, whoever is receiving the service, must also be enrolled in Medicaid. This is a separate distinction from the Medicaid coverage. Now we're talking about individual coverage. So a little bit of background to help contextualize how it is determined whether someone is eligible or enrolled in Medicaid. Medicaid is an entitlement program. And that's a term you may have heard thrown around in some political discussions, but what it really means is that whoever meets the eligibility criteria has the right to enroll. There's no dilly-dallying, there's no delays, wait lists, or anything like that. If someone is determined to be eligible, they meet eligibility criteria, they have the right to enroll without delay. Now, there are 2 broad categories of eligibility that an individual must check the boxes for in order to be determined eligible. First, they must be in a particular eligibility group. This is typically called categorical eligibility. I'll list some of those categories on the next slide, but just briefly to remind you, as I mentioned earlier, Some of the major groups enrolled in Medicaid include children, pregnant women, and individuals with disabilities. So those are the sorts of categories we're talking about. And then within each of those categories, the individual's household income must be below a specified income threshold or limit. So in order for an individual who is classified as a child in terms of categorical eligibility to be considered eligible for Medicaid, that individual's household income must be below that group's income threshold in the state. Now, one tricky thing about enrollment and eligibility is that income can fluctuate, right? Many folks have income that fluctuates over the course of the year for different reasons. And so it can be tricky to sustain eligibility because it must be recertified every 12 months or so, sometimes more often, sometimes less often, usually less often under the Affordable Care Act. And so what that really means is if someone is determined to be eligible and is enrolled in Medicaid for some period of time, if they don't recertify, they will lose eligibility. They will lose enrollment unless they take action. That ends up being a pretty major stumbling block for many children and other Medicaid beneficiaries because it can be something of an onerous process to provide all of the pay stubs and other documentation that might be needed to verify eligibility. And again, it does have to happen every 12 months or so. So to give a bit more detail on categorical eligibility, these different groups that a Medicaid program covers, again, we're using the terms mandatory and optional to describe these different groups, like we did for covered services. The federal government requires that certain groups be covered in a state's Medicaid program. That includes low-income families and children, and disabled individuals, including disabled children, as well as children in adoption assistance, foster care, or guardianship care. All of those groups must be covered in the state, at least to some extent. And then there are also optional eligibility groups that may be relevant for our discussion here. States may choose to cover certain groups like Katie Beckett waiver children. These would be children under age 19 with long-term disabilities or complex medical needs who receive an institutional level of care at home. So some states have completed the waiver and gotten it approved by CMS that allows them to cover this group. And there may be other groups that states cover as well. Again, this is optional though. Your state may not cover those groups, but they would cover low-income families, disabled individuals, and children in certain guardianship situations. And then again, within these eligibility groups, there are income limits. So the individual's household income has to be below the specified income limit or threshold that is associated with the eligibility group in your state. Now, in your state, those income limits for each eligibility group are usually specified as a percentage of the federal poverty level. So it might be 140% of the federal poverty level. Now, if you're not familiar with what the federal poverty level is, it's a relatively low amount of income. In 2022, it's about $28,000 for the household for a family of 4. So relatively low income limit. But again, income limits vary. And so the income limit for a given eligibility group in your state may be much higher than that. Now, federal regulations establish some minimum income limits that the states have to cover individuals in the eligibility groups with income below those levels. But states can choose to be more generous and cover individuals with higher incomes up to limits that the state sets. I'll go through an example of these different limits and different eligibility groups in a moment here, but I just also want to highlight that there is this other program that is related to Medicaid that usually has higher income limits and also provides insurance coverage like Medicaid does. And that's the Children's Health Insurance Program, or CHIP. So CHIP is, again, like Medicaid, jointly funded by the federal government and state governments. However, CHIP's focus is mainly on covering uninsured children in low to middle income families who don't otherwise qualify for Medicaid, usually because their household income is too high to meet the Medicaid eligibility threshold for a given eligibility group. Now, one other key difference between CHIP and Medicaid is that CHIP is not an entitlement program. Medicaid is an entitled program. If you're eligible, you're entitled to coverage. CHIP is not. Children who are eligible for CHIP coverage but not Medicaid may face other limits when they seek to enroll. There may be waiting periods, wait lists, there may be lotteries or other ways of limiting access to that program that states may employ. So there may be some value in helping to verify a given child's eligibility for CHIP sooner rather than later, in case they have to go through that waiting period before the program will start to cover their benefits. There are also some changes, some differences between these programs within states, depending on your state, that are worth making yourself aware of if you're interested in coverage for an individual who doesn't quite have the income in their household low enough to cover to receive Medicaid coverage. So different types of services, for example, may be covered in Medicaid versus in CHIP. All right, so what I'm showing you here is a detailed table for the 8 states in the Southeast region. What are the income limits for children at different ages? What are the eligibility limits for Medicaid and for CHIP in terms of income? So again, all of these are specified in terms of percent of the federal poverty level. So for Alabama, for example, regardless of the child's age, if they're under 1, 1 to 5, or 6 to 18, in Alabama, if the household income is below 141% of the federal poverty level, so 141% times $28,000 for a family of 4, the children in that household can be eligible for Medicaid. In Alabama also, they have a CHIP program with a higher eligibility threshold. So households with income at 312% of the federal poverty level or below, children in those households may be eligible for the CHIP program, even if they are not eligible for Medicaid. In different states like Florida, for example, the income thresholds may be different for different age groups of children or for different eligibility groups, and for both Medicaid and CHIP. So the main takeaway here is that if you know one eligibility group's income limit, you know one eligibility group's income limit. And it's worth verifying what the income limits are in your state for children who might qualify for Medicaid on different basis, either because they live in a low-income household, or they have a disability or are otherwise eligible for Medicaid on a different basis. All right, so that was the second requirement of the 4 that we're talking about today. Let's get into poll question number 3 here. The biggest challenge we face with student enrollment in Medicaid CHIP is which of the following? Is it administrative burdens? Incomes tend to be too high relative to the income thresholds, the eligibility thresholds. There may be reasons other than income that individuals in an area are not eligible for Medicaid or CHIP. Is there an issue with recertifying eligibility and churning enrollment, where you gain or lose periodically, or is it something else? All right, Sarah, again, I'll look to you to notice when the poll responses have slowed and we can start to look at the results together. All right, so the plurality of folks answering this question indicate that the biggest challenge is administrative burden of verifying eligibility and completing the enrollment process. There's no question that it is a burdensome process in many states often to provide the pay stubs and residency verification and other information that Medicaid programs require or CHIP programs require to verify eligibility. And then another 25% of respondents indicated that the churning enrollment is an issue. Again, administrative burden associating with having to provide all of that information, perhaps every 12 months, that is taxing and can lead to individuals dropping out of coverage. But certainly there are many issues that many different school districts and providers and other advocacy organizations, community organizations contend with when dealing with eligibility for Medicaid and enrollment in the program. All right, so let's get to the third requirement. So we've covered coverage of services and coverage of individuals. The provider must also be a Medicaid certified provider, and not all are. So different Medicaid programs have different requirements for what the providers must meet in order to be considered Medicaid certified. But typically, it is a function of the state's licensure and certification requirements. That is, the provider must meet those, and most providers do in order to practice in the state anyway. So that's usually not a limiting requirement. But providers must also complete an application, and those applications can be burdensome. I'm aware of some surveys of providers that have indicated that they choose not to participate in Medicaid primarily because they find the paperwork and red tape to be too burdensome. So that is, those are the main requirements. There may be some other requirements as well, but providers do have to meet them in order to be considered Medicaid certified and to bill Medicaid for any services rendered. So if you at the local education authority level or school district level or the state level are looking to work with or contract with community providers or hire providers in order to bill Medicaid, or that you would plan to use to bill Medicaid for services, it's worth checking to verify that they are Medicaid certified before you sign the dotted line or execute a contract. And also, if you are looking to partner with a provider in the community, this is also worth checking and verifying that their providers are Medicaid certified. So there's an important caveat here. I haven't mentioned Medicaid managed care yet, and some of you may be familiar with Medicaid managed care organizations or care management organizations that do put a bit of a wrinkle in this Medicaid certified provider requirement. So many states administer Medicaid not directly, not themselves from a state agency, but rather through these managed care providers. These are plans, these are private health insurance plans that administer Medicaid benefits on behalf of the state. Now, each of those insurers, and the state may contract with multiple ones to cover beneficiaries in your area. Each insurer may have its own unique billing rules, and they may have their own rules for deciding whether a given provider is in network for them or not. So it is important to track not only that the providers you want to work with are Medicaid certified, but if Medicaid managed care operates in your state, and more than 80% of Medicaid enrolled children now are covered by a Medicaid managed care plan, one or more of them, and it's important to verify that the providers are also contracted with those Medicaid managed care plans, at least one of them in your area, preferably all of them, and be in a plan's provider network in order to receive reimbursement from those plans. So it's an extra layer of checking that the provider is Medicaid certified and eligible to receive reimbursement. Now, Medicaid managed care has a lot of other wrinkles to it related to some of the other requirements we've been talking about today. So I would definitely encourage you to check out a previous webinar that I gave or that I led related to the financing of school-based mental health services in the Medicaid managed care context. That's linked on the slide here. And there are other resources related to Medicaid managed care on our website as well. The fourth and final requirement is that the school is a Medicaid accepted setting. That is, it is an acceptable setting to the Medicaid program in your state. So this is an interesting one. As of December 2014 and more recently, billing Medicaid for services in school settings is now permissible in accordance with the federal government's guidance. However, not all states yet are leveraging this guidance. And so not all Medicaid programs are currently reimbursing for services administered in school settings. There are a variety of resources out there, including the Community Catalyst resource linked on this slide, that speak to where states are now relative to this new guidance concerning something called the free care rule. However, it's important to recognize that not all states have to take any kind of action at all in order to leverage this new guidance. The Community Catalyst resource tracks active efforts by states to leverage this new guidance, but not all states have to do anything at all. So again, it's worth checking in with your state Medicaid agency to see where you are relative to this guidance and whether schools can be considered an accepted setting for billing Medicaid if you're not sure. Now, Some of you may be familiar with the fact that schools have been an acceptable setting for a long time for services rendered to certain students, that is, students who have an IEP or an individualized education plan as specified under the Individuals with Disabilities Education Act. So historically, if a child was enrolled in Medicaid and they were eligible under IDEA and had an IEP, Medicaid would generally cover many of their behavioral and medical services when administered on school grounds or school-based. But the new guidance that I referred to on the previous slide makes that a possibility for everyone. It's just a matter of where the state's Medicaid program is relative to implementing new guidance. But it still is the case that if a child is Medicaid enrolled, they have an IEP, they're IEDA eligible, then regardless of where the state is regarding that guidance, school-based services are reimbursable under Medicaid. Okay, so those are the 4 requirements about the service. The service has to be Medicaid covered. About the recipient, the student or client who's receiving the service has to be enrolled in Medicaid. The provider has to be a Medicaid certified provider, and the school has to be a Medicaid accepted setting. So all 4 of those conditions have to be met in order for Medicaid to reimburse you for a school mental health service. If any one of these falls through, Medicaid won't pay for it. So you do have to verify all of these for the services and programs that you're leading. Okay, so before I wrap up and conclude here, I want to do one more poll question with you all. Let's pull that up here. Which of the following is the biggest outstanding question you have right now about Medicaid and financing school mental health services? We've got a whole list of questions here. Go ahead and pick the one that you have right now as the most important one in your mind, including some questions that I've tried to start answering here, but that might require additional resources to fill in the gaps. All right, Sarah, let me know when the results are ready to be viewed. All right, so the number one question that remains outstanding is, how does Medicaid pay for school mental health services? I think that's mostly a question about process. How do you actually bill? What does Medicaid do with that bill or that claim? We have some good information and resources about that on the MHTTC website. And then there's, what are the major types of Medicaid reforms? So if Medicaid is not working for you in the way that you want it to for your school mental health programs, what are the mechanisms by which Medicaid's procedures, policies can be modified to better suit the needs of your community and your state? This is great to know about. We can continue to dedicate our resources to building more resources, infographics, webinars, products for you to help keep you all informed. Certainly continue to visit our website, follow us on social media, subscribe to our newsletter, and get information about other products as we develop them along these lines. Now, one product that we are working on right now, and that will be available to all registrants and you all very soon, is a report that we've put together called Medicaid and School Mental Health FAQs, your frequently asked questions. And wouldn't you know it, all of the answers to that poll question that you've all answered a moment ago are answered in this report. There's an introduction, but then after that, we answer the questions: what is Medicaid? When will Medicaid pay for school mental health services? What services does Medicaid cover? Who's eligible? What providers can bill? Are schools an accepted setting? All of those questions are answered in this report. Now, we expect that report will be available and posted on our website within the next couple of days. We're very excited to release it all to you. So look out for an email from us. It's going to be going out to all registrants for this webinar. We will notify you when that report is available, and we'll be excited for you to download it and utilize all of the resources, the links that are in it, references, and the content that we've spelled out in plain language, the answers to all these questions. And just so you know, a second version of the report is in the works. We are also planning to add frequently asked questions about Medicaid managed care. How does Medicaid pay for school mental health services? That was your #1 question in the poll question a moment ago. And what are the major types of Medicaid reforms? The #2 response. We anticipate that this full report that includes answers to these questions too will be available in the next month or so. So stay tuned. Again, continue to visit our website, follow us on social media, and subscribe to our newsletter to make sure that you get access to that full report as quickly as it is available. All right, so that's my conclusion. Tara, let me turn it back over to you for the Q&A portion.
Thank you so much, Adam. That was a wonderful presentation. And before we move into the Q&A, I would like to introduce Wilk Hu. I know she's been answering all of your questions in the chat box already, but to give a formal introduction, she's an expert in Medicaid and Medicaid managed care, and is the lead author on the Medicaid and School Mental Health FAQs report that Dr. Wilk just described to you, and that we're so excited will be published soon. Wilk's research interests lie in the intersection of Medicaid policies, especially Medicaid managed care, access to mental health care, health disparities, and underserved populations, such as children with complex healthcare needs. So I don't see any outstanding questions in the chat box. Oh, I think one just came in. So Elizabeth Duncan asked, can you discuss requirements for parental consent to bill development of care plans for mental health services? And you can feel free to use the raise hand function after we'll go back and forth between hands raised and the chat box questions.
So thanks very much for the question in the chat. And as Tara said, please do keep the questions coming in the chat. With respect to this particular question, Wilk, please feel free to fill in any gaps that I miss here. Yes, so in different states and in different Medicaid managed care programs or plans within a state, there may be different documentation requirements that an individual or a family or a provider may have to complete in order for a service to be billable to Medicaid. The requirement that you speak of may not be representative of something that all individuals on this call have to deal with. But in your context, it may be necessary in order for a Medicaid managed care plan, for example, to accept a service as billable for a student. It will only be acceptable if that kind of documentation is in-house, if it's logged, that the parent's consent has been obtained in order to bill Medicaid for the service. And some of that has to do with the fact that the family members, the parents, other siblings, may also have the same insurance coverage. They may also have insurance through the same plans. And so there's a matter of concern about disclosure of certain services that may be sensitive. So a given student may have concerns about services they receive being disclosed to their family members and so on. So that is the nature of those sorts of requirements. Again, they vary a lot by state and by plan. So it's worth getting to know all of those sorts of requirements. And in fact, making friends with contacts at the Medicaid managed care plans in your community and the Medicaid office so that you can help get answers to those kinds of questions on a prompt basis. So I'm not monitoring the chat right now. I don't know if any other questions have come in. We do also have a hand raised from one Miss Emily Meeks.
Yeah, we can take Emily Meeks's question next, and then after that, I see Libby and Nialis have a question in the chat. I can read that out.
Hello, can you hear me?
Yes, go ahead.
Okay, thank you so much for doing this very informative session. My question would be for community-based support. We offer a lot of educational, community-based mental health support. How would a company such as myself, or do you think that we could become Medicaid providers, given that we don't actually give any type of diagnoses or provide any medicine? it's more of a holistic approach, how would we go about entering into this space?
Good question. So the first requirement that I spoke about in today's talk is the service has to be a Medicaid covered service. And there are mandatory benefits, there are optional benefits. Some services may be covered in some states, but not others. Ms. Meeks, I'm not sure what state you're speaking to, and honestly, I'm not sure I'd be able to answer the question specifically to your state in any case, because every state is different, and I only know so many Medicaid programs details. Allison, please feel free to fill in the gaps. But the best thing to do generally, is to go to the Medicaid website and see if you can identify the services that align in terminology best with the kinds of services that you typically provide in your organization. And the same is true for anyone on this call. If you have a community partner, or if you yourself are a community partner to schools and school mental health program leaders, take a look at the full list of services that you might be eligible for providing and getting reimbursement for. And of course, again, there may be differences across plans too. Ju-Chen, would you add anything to that response?
Yeah, so I think Medicaid does have limitations on what type of services they reimburse for. And mainly, I think Medicaid reimburse for services like screening, diagnosis, and treatment. So for services like health promotions or more like tier 1 type of services for school, there are more fundings from outside of Medicaid, for example, from the Department of Education, which is not like in today's discussions, but it's still another source to consider for seeking fundings or to build relationships or collaborations between your organizations and schools.
Okay, can you please drop that name in the chat, please, that you just said, the other organization?
Oh, that's the State Departments of Education. Every state will have a different name for that agency. But there are lots of different funding sources made available through those organizations, those agencies that are worth knowing about.
The agency. Okay, thank you.
Thanks so much. And I think we have time for one more question. Libby and Nialis are calling in from Maryland, and they asked, how can we push state Medicaid leaders to make the necessary state plan amendment changes to include school-based Medicaid reimbursements?
Ju-Chen, maybe I'll let you take this one first. Is that all right?
Yeah, so I think this is a great question, and it's going to be covered in one of our sections in the upcoming report. So generally, they are many states using state plan amendments or like different types of reforms to include more services, school-based services for Medicaid to reimburse for. And these needs to go through some like processes between the state and federal government. I think it will be like take a lot of time from us to go through all of the details in the processes, but I'll encourage you to follow up those questions in our upcoming reports, which we're going to provide detailed information of what a state plan amendment is and how states should work with the federal government in order to get approval for a state plan amendment.
I might add too that there are a lot of other resources that our school mental health initiative at the MHTTC has put together about effectively communicating with fellow leadership at the state level or in your community about how to promote school mental health and secure more funding for it and so on. So I would strongly encourage you to take a look at some of the other resources on our website about those modes of communication and sorts of measures that might be useful to put together in order to really motivate action on the part of your partners at the state level on these sorts of issues.
Thanks, Adam. And I think we do have one more minute. If Emily, if you want to come off mute again, we don't have any other questions, so feel free to ask your last question.
Okay, I'm sorry. It's one more question based on something that they brought up in the session. They said that if a provider, like a doctor, does a screening and the screening states that they need this particular service, that they still have to pay for that service, even if it's not, I guess, essentially covered, once the person who diagnosed or gave the screening puts it down as a suggestion. Am I understanding that correctly?
Yeah, so this is an important bit of detail to get correct. The EPSDT benefit, which I think is what you're referring to here, the early and periodic screening, diagnosis, and treatment benefit, which every state has to cover, is focused mainly on the chain from the screening to the diagnosis to the treatment service. So if it's an EPSDT covered screening and needs are identified through those screenings and subsequent diagnostic services, then Medicaid must also pay for the associated treatments in order to meet that identified medical need. And that is true regardless as to whether Medicaid has already said ex ante they will cover those kinds of services. So if a diagnostic service and the screening covered by EPSDT determine that there is that medical need, Medicaid will pay for the treatments to meet that medical need, even if they haven't previously said they'll cover that kind of service.
And so then who would do the billing for that? So would that person, let's say we're giving that service, do we send out something billing to Medicaid? Can we do that, or would the diagnostic person do that?
Yeah, whoever is administering the service is typically the entity that submits the bill. So whoever provides the screening service would bill for the screening service. Whoever provides the diagnostic service would provide the bill for the diagnostic service and bill accordingly.
Got you. Thank you.
Thank you.